Hi, Mark Nemes here from Content Labs, and today I am honoured to have basically Matthew Smith with me from MyPath Global. How are you, Matthew?
Yeah, doing great. Thanks, Mark. Thanks for having me on board.
Cool. Look, Matthew, the reason I really wanted to interview you today quickly is that many startups fail because they generally solve a problem that no one really cares enough about, or they don't care enough to basically pay or invest in that solution. And as someone ourselves who works in health and care, often they haven't also worked out what the paying ecosystem is, or where the particular problem is going to be paid for. So to that credit, I'm always interested to interview people that are solving problems in other industries that see that they can apply what they've learned from those industries into health and care. Now, I'm really interested to learn why Matthew Smith, a successful engineer in mining and infrastructure, decides to back his own ability and start up MyPath Global.
Yeah, no, it's a really interesting point you raised there, Mark. So our journey, as you pointed out, didn't start in the health and care side. It did start in the heavy regulated sectors, particularly as you mentioned, their mining and oil and gas and infrastructure. And it really came from my firsthand frustrations in those sectors. So having to manage large, sort of thousands of people in the field, and making sure that they're trained and competent to do the tasks they're doing. And when I realized that working for one of the largest companies in the country that provided trades labor services to sites, and we were running off spreadsheets, I realized there's a pretty big problem to solve in the sector. And so, fast forward 7-8 years, we've got a great head of steam there and some real traction in those sectors in terms of getting whole of industry to simplify, standardize, and share in terms of the way they manage that workforce information. And it was through some contacts I had that were actually in the health and care sector, specifically aged care as well, who actually brokered some conversations with the Victorian government and the Department of Health there. And we latched onto some pretty innovative people there that said, hey, the same problem you're looking at in mining resources actually exists in the care space and in the health sector, where you've got the same problem just served up differently, where you have people moving instead of from mine site to mine site or oil and gas facility to oil and gas facility. You've got carers that are moving from either aged care home to aged care facility, into people's homes, into disabilities. And it's the same problem. It's very hard to track and manage people in that format. So I guess for me in our business, we just recognize that same problem statement and that pattern with different actors in the play, so to speak.
So you looking at the health and care sector as an outsider, well, not as an outsider, someone would say a fresh engineering set of eyes. If people are moving from site to site and the need for their qualification is effectively the same, is there a huge difference between the two? Or are you saying, no, look, you know what, we've seen this problem before, it's actually not that hard?
Yeah, for us, it feels like we've kind of solved the tougher exam question, where to send someone to an offshore oil and gas rig, for example, they literally might need 15 to 20 certs, attainments, inductions, background checks, health checks, you name it, before they can actually mobilize. And it can be over 100 process steps to get to that point for a lot of companies. And if things go wrong, they go really wrong, right? Like things go boom on a platform if people make a mistake or do something they're not trained and competent to do. So to kind of solve that problem and work with some of the largest companies in Australia that are energy and resources companies, I guess gave us the confidence that this is actually a slightly easier exam question. And as I mentioned before, it is critical that in the care sector, people actually are trained and competent to do what they do. It might not be as big a public event that something that goes boom, but I know from a personal level, with any loved ones I have that are in a care situation receiving care, I certainly want to make sure someone that's looking after them, where actually is still life and death, is trained and competent to do what they're doing. It just means they might have half a dozen attainments that you want to track rather than sort of 15 to 20. So I guess to answer your question more directly, the exact same technology we've deployed into care and volunteering, for that matter, is the exact same technology we've used elsewhere.
It's interesting because if you're talking about your experience, say in aged or community care, one of the things that comes back is that in a marketplace, there's maybe 10% of people that are, leading edge, early adopters. They have to try new things, and they see that as something they need to do. The care sector is not known, let's say, for being the most innovative on the planet. They're known certainly for being caring. They're known for perhaps the qualification level of the great percentage of the workforce is not there. English is a second language in many of the emerging workforces. Is that a challenge for you, or how are you solving those?
Yeah, good question. Look, it's definitely a challenge. I guess the benefit of us actually having solved this problem in another sector is we can kind of have a lot of credibility coming into that discussion, where we don't have to say, oh, look, we've got this really great concept. We're going to come in, we're going to have this user-centric model with a digital passport, and people own their information, and this ecosystem all kind of plugs together, and try and get them to buy into the vision and the concept. We've kind of done that. And so we can kind of put that part of the puzzle aside, or part of the solution aside, and say, look, we know we've got a model where all of industry can win, and everyone can get on the front foot there. And so therefore it just comes down to finding those early adopters, as you say, who are willing to give things a go. And I guess where we've spent a lot of our time is trying to learn. As you said, we're not experts in the health and care sector, but we're keen to learn, and we're learning a huge amount by speaking to peak industry bodies, by some of those earlier adopters that get on board. I mean, one of our earliest pilot partners is Glenview out of Tasmania, who are known for being an early adopter, and they could test some of the functionality right in the heat of COVID as well. So they're out there. You just got to search a bit harder, I guess, and try and, I guess, join the dots as to why this problem here actually maps pretty perfectly. And from what I'm hearing and from what we've experienced so far, it definitely is the same problem, just served up in a different context.
So we had sort of spoken to health economists, and the healthcare market is roughly 10% of GDP, roughly 15% of the Australian employed workforce. With the movement of, when you're talking aged and community care, almost everyone talks about the care homes or the care groups, which has a few 100,000 beds in it. Yet more than 1 million people are actually sort of providing care in the sector. Yet about 300,000 are basically paid. So when you take those mass stats, what is it you see in the mining industry that they do really, really well? That's an easy win in the care sector. What can they do first? How can they start? Right, quickly and get that whole thing going?
Yeah, good point. So what I see quickly is just getting a stock take, if you like, as to how competent is the workforce. So when you look at a lot of the recommendations that come out of the Royal Commission, there's a number that are actually tied to workforce, and actually having that line of sight in the first instance as to, who am I dealing with here? What is this baseline of standard? How many people even have Cert 3s? How many people do have the basic fundamentals around understanding dementia and dealing with certain people with, say, disabilities, if you're working in the disability sector. And to be honest, I don't think people even know, what that landscape looks like. And that number's bigger, as you know. I've heard numbers and read numbers on government websites up to 2.65 million carers in Australia that are daily actively involved with someone who's got a disability or medical condition or mental illness, or someone that's aged. And as you say, a small subset of that are actually paid. And so there's actually an intersection of not just paid people, but volunteers. And so we're pretty excited about the work we're doing in the volunteer sector, which means you don't have to have a solution that's just volunteering, which we've heard and seen play out, like you've mentioned, where things kind of wither on the vine because the funding's not there. And you don't have to have a solution that just suits aged care, and you don't have to have a solution that just suits disabilities. You can have a solution that can actually fuse all those together, where an individual might be a volunteer one week, they might be working disabilities the next, and they might be working in aged care the next. And so that transferability is key. So coming back to my earlier point to respond to this particular question, if you actually know what that skills and competency set looks like within a region, within a company, within an industry, then to me that's the starting point. Then you can start to look at, how do you build a competency profile or a career journey for that carer from that point forward. And I think it's impossible to try and do this from the top down with companies to, try and pull this information together, as opposed to a bottom-up data model that we've applied where the individual owns and controls their information, and therefore you can aggregate that up through a permission structure to actually see that whole piece in one holistic view.
Yeah, it seems to be the notion that somebody somewhere controls your data, whereas if that's an individual passport, and we're hearing more, I think the world is probably, obviously comfortable with their personal passports for traveling. You're now hearing about COVID passports and tracking, and then you have your immunization passports, etc. I would imagine all of that sort of tying together. I mean, if you were a care group right now, and you had the operations director of the care group sitting in front of you, pulling their hair out over sort of tactical responses to, staff and skilling issues, what would you say is the thing that you could deliver for them almost immediately?
Yeah, almost immediately would be a couple of things. Firstly, to take some of that risk and cost away from them. A lot of people are taking on that burden themselves of maintaining on behalf of an individual, or their training and competency information, where we can actually empower the individual to maintain that. And if they're not tech savvy, which we talked about earlier, well, then you can still do it on their behalf, but over time, coach and train people to do it. So straight away, take a lot of that admin burden away.
Yep.
And also by doing that, you're also reducing your risk profile. So, now you can have an auditor turn up on your doorstep unannounced any day, and you better be ready to prove and show every first aid certificate, every Cert 3, every background check for all your staff. And for a lot of companies right now, that's an absolute scramble. And you can be 2 clicks away in our platform from doing that, because we know what it's like to have to prove that safety in the field and that competency in the field. And then thirdly, which we've seen play out in other sectors as well, is a massive skill shortage at the moment for competent carers. And we can provide a very streamlined way through an applicant tracking system that's built in to rapidly onboard different carers and health professionals, where they can actually self-upload all their training and certs. We verify all that information, so that verification process gets taken away, and actually be a company that's easier to engage with. So instead of putting people who are highly sought after and scarce, or a very sort of clunky and onerous process to onboard into your organization, or even to become visible to you, we can really speed up that whole onboarding process, and also help to build pools of available people. So you can actually proactively manage a talent pool or a resource pool, rather than hoping that someone's looking on Seek or looking on your website at the moment you need someone. So there's a few ways of trying to get to that ultimate point of the right person or the right people with the right skills at the right time. So that's where we would steer them.
It's interesting. When you look at the care sector specifically, there seems to be tactical versus strategic. It's like, at the moment, the feedback we're getting is we don't have time to be strategic. Like, I mean, literally, it's just 1 minute we're having to do this, we're having to move people in, we're having to move people out, then we can't move people at all. They're not allowed to change sites. So it's constantly evolving. And for a sector that really prides itself generally on sort of face-to-face interaction, and they generally, the patients or the customers of the services in health and care often don't like the constant change. They actually like the regularity of dealing with the same people. So, I mean, from what you've really shown is that these sort of digitization processes is, if you're using some spreadsheets, that's not a digital process improvement, right? So, or even God forbid, if you're not using spreadsheets, right? So if you are using spreadsheets to manage the site, great. If you have a couple of sites and then you have someone who taps on the door and says, I need this information, you then realize how hard that is to basically pull it through. So if this is deemed innovation, and it is, would you see that is it's not actually innovative, it's actually safer to do this innovation than not doing this innovation? So in this case, like in most cases, it's not a discovery of the unknown. It's no, this actually is better than your alternatives. You couldn't do this before from the technology that was available.
Exactly right. And I don't think a lot of people realize that they're actually putting themselves at risk or increasing their cost base by doing nothing. Might seem like the safe option to, we see people that still have filing cabinets, like, so a spreadsheet would be a step forward. And if that's the way you want to keep going, fine. But you're going to keep wearing that admin cost and that burden where you're not actually doing value add work that you could be doing if you reallocated that resource to the front line and providing quality care. But secondly, that example I just gave before, you're exposing yourself. If you're suddenly in reactive mode, having to go into that filing cabinet, go into that spreadsheet and crossing your fingers and your toes while you're trying to find the information for the regulator, that's not a position I'd personally want to be in. And we've heard success stories of people that have passed the audits with flying colors because that they can relax back in their chair and within 2 clicks show the auditor, search by name, search by cert, search by anything. The data's there and it's there in a really efficient way and it's verified. And that makes a big difference in terms of that peace of mind and also reducing operational costs. So yeah, like there is a cost to stagnating, and we do acknowledge not everyone's at the front end of that adoption curve, but
Yep.
we've really worked hard to get a model not only where everyone wins, but which can kind of get going really quickly. And that's the benefit with cloud-based software as well. We can get companies set up in days, not weeks. That can really just data.
So Matt, you've clearly articulated expertise in call it a traditional old world industrial industry. The workforce challenges are really quite similar, right? The outputs are different, granted, but the actual workforce challenges are incredibly similar. And the need for certification and validating that certification, I guess the question is, not having them is bad. Not being able to document whether you have them or not is probably even worse. It shows you don't have a process or a system in place.
Correct. And not being able to access the skills and capabilities you need to let your business grow is also a shame. It's a missed opportunity. And we're speaking to companies who, because of some of the recent allocations in the budget, can actually bring on new clients now. And there's a financial incentive to do so, but they can't find the workers to deliver the service. And what's the point in having funding there in a bigger business that you can grow if you can't even deliver on the promise? So it actually is hamstringing growth as well for these companies that actually could be achieving economies of scale, that actually could be achieving their growth targets, but they can't get their hands on people. So something has to change, or else it'll be just be Groundhog Day with companies trying to get their hands on the right people.
So you've got some great examples of what you've done in other industries. I know you're actually putting together some case studies and white papers on this. And so if people generally want to learn how to apply that best practice management around certification in an organization, where should they go?
Yeah, so they can head to mypassglobal.com, and you'll see at the bottom of the page there, we've got a tab for health and aged care. Yep. You can go in and have a look at that as a sector. And as you say, we're building some resources there to share that knowledge that we've learned in other sectors. And watch the space. We'll have a couple of other sort of bits of information that we're learning from some of the steering groups and facilitations we're doing around helping companies to adopt technology in this space as well.
Yeah, and what I absolutely love, and I love is where you are in the marketplace. You've clearly articulated where you are. You articulated where you want to go and what you want to do. And from a organizational perspective, if a health and care wants to learn about that capability, hit the website, learn from those organizations, learn from the vendors in the space, because they themselves are giving you the information from others. And what I see here is this is a practical application of this. And I always ask the question to the organization, everyone can tell you why they're not going to do something, but I would say, well, if not this, what? And if not now, when, right? So if I'm not going to do something about this, that's fine, let us know. But if I'm not going to do something about it, what's going to cause me to basically do something about it? So to that end, I absolutely applaud you for basically putting your ass on the line and backing your ability around this. And I look forward to seeing this expand into the industry, because we know this needs to happen.
Excellent. No, look, 100% aligned there, Mark. And yeah, thanks for the opportunity to share our story.
Cool. Cheers.